immunodeficiency is where you have a problem in the formation of the immune system. I think that the most important thing for the public to know about primary immunodeficiencies is the warning signs.
I'm Matthew Piggott and I'm 14 years old. I've perforated my eardrum 3 times. I didn't actually know that I perforated it the first time until blood was like trickling down my ear. I have a lot of excess scar tissue now built up because I've had so many. I can't hear as well as I used to be able to.
I'm Paul Caldwell. I'm 63 years old. There was a time when I was afflicted with a really bad headache that wasn't going away. They diagnosed I had a fluid level in one of the sinus cavities, which indicated sinusitis, and I was in the hospital for 11 days.
My name is Lori Peters. I have 3 children. Madison is 17, Brooklyn would have been 13, Sheridan is 12, and Ethan is 10. When Brooklyn was about 3 months old, she got a runny nose, just a normal everyday cold for a baby, but it turned into a cough, which then turned into RSV. She was given antibiotics and other medications, but then it turned into pneumonia. Weeks later, we were back in the hospital again with pneumonia. It turned into double pneumonia, and she ended up passing away.
I'm John Paul Jones, and I'm not really sure when I was diagnosed, but I believe it was around 1964. A lot of colds, a lot of pneumonias, but I was sick a lot. I believe it was grade 3 when I had my lung removed.
Hi, I'm Vidya, and Vedant is my son. Initially, he could not take the bottle, milk bottle, so they had to put NG tube, and that was a bit tough because Vedant was just 11 months old then. He was uncomfortable initially, so sometimes the NG tube would come out with his cough. Sometimes even thrice they had to put it back in a day, and that was a little tough.
Hi, I'm Gina, and my son is Julian. He is 9 years old. He was 18 months when he was diagnosed, and his symptoms were he wasn't eating, he had a lot of diarrhea, and fevers, a lot of fevers. They found a little abscess, so they did testing on that. Well, if he didn't have the transplant, he probably wouldn't have survived.
Hi, I'm Brenda. I'm a clinical nurse specialist and I work with patients with primary immune deficiency. You can imagine that having thrush in your mouth all the time makes it very difficult to eat. Sometimes it's so severe that it actually goes all the way down on the inside of your body, down your esophagus.
My name's Vanessa, and my son's name's Austin, and he's 14 months old. He was on cloxacillin for 3 weeks IV, and we got sent home with the IV. It was challenging. We had to chase him around with the IV bag, and because he's an active little boy crawling around. Now our next step is waiting for bone marrow transplant.
My name is Pablo. I'm 6.
I think he's the one helping us. It's like he was prepared for this. He was born just to teach us because the way he takes it is just amazing, and we just encourage him.
It doesn't hurt when you do a needle because my mom always hold my hand. Ethan and I'm 10. They tested me because my sister Brooklyn died from SCID and I have it too, so I had a bone marrow transplant and now I'm perfectly fine.
People with primary immunodeficiency largely can lead a normal life if they can get identified and treated early. But I think the real challenge is being identified and making it to the doctors that can help them.
As horrible as it is to get the diagnosis is so huge because it is treatable and curable, and as soon as they can start fighting it and curing it, you're already in the win column.